If you struggle with your mental health, you're encouraged to recognize it, talk about it, and get help from a professional. Bell Let's Talk Day is happening January 21st, and it's a national reminder to take action on breaking the stigma surrounding mental health issues. Since 2011, Bell, which is the parent company of CTV, has donated more than $4 million to local mental health initiatives, organizations, and services across Manitoba. Joining us now to tell us more about what's happening this year is the chair of Bell Let's Talk, Mary Deacon. Good morning, Mary.
Good morning.
Thank you so much for joining us. Now, you're in Manitoba because you have some announcements to make. What can you tell us about those announcements?
Well, these are announcements that we're making to support families, children in the province of Manitoba. We have a big focus on access, improving access, and we know that particularly since the pandemic, we're seeing more kids arrive at the emergency department at children's hospitals experiencing mental health crisis. We're seeing more young people struggling overall with their mental health. We're just seeing it's just much harder since COVID, and the numbers seem to be going up of people seeking help. Now that's a good thing, more people seeking help, but it puts pressures and demands on the system, and that's why Bell, through Bell Let's Talk, is funding community and hospital initiatives in Manitoba and across the country.
This program has been going on for 16 years. In that time, a lot of great things have happened, haven't they?
Yes, we started in 2010 with a blank piece of paper, but made that sort of bold decision that mental health was an issue that was deserving of the kind of support that other common treatable health issues got from government in terms of funding and from the community in terms of philanthropy, and that these services would be available to people where and when they needed them, close to home. So we've always invested a significant amount of funds in access, but we started Bell Let's Talk Day, which we wanted to give an opportunity for Canadians to have a platform to talk about mental health, and for those mental health organizations to have a way to talk about the programs, talk about the services, bring awareness to what they were doing, and point out both the good, bad, and the ugly about what's available, and to really keep the pressure on in terms of raising the bar of what we as Canadians can expect when it comes to getting help in our own communities.
Every year there's a theme for Bell Let's Talk Day. What's the theme this year?
Take a moment for mental health.
Okay, what does that mean?
So what that means, we all know, I think, that this is a challenging time. We have economic uncertainty, there's global uncertainty, and it's nice for me, and I think for a lot of people, to know that there are practical, simple things we can all do to take care of our own mental well-being. So those are things you typically think of, like mindfulness and meditation, breathing exercises, being out in nature, exercising, listening to music, digital detoxing, right? Spending time, real time, with people and family, sharing activities, and practicing gratitudes. These are easy, simple things that we can all do to support our own mental well-being, whether you have a mental health issue or you don't.
Just to maintain where you're at, but if you are in crisis, you're asked to call 911 immediately.
Or 988.
Okay.
Canada now has a national service, 988. Wherever you call from in the country, you will be directed to crisis supports for mental health. So if you are having a mental health crisis, call 988 or go to your local hospital.
Mary, thank you for sharing this with us today.
Thank you.